to this story now. Some healthcare workers, including nurses, have been suspended in the Eastern Cape over a patient's death. It's alleged that they refused to help the patient suspected of having the coronavirus because they didn't have protective gear. Now, earlier, Bisho Hospital in the province was closed after a nurse died and 3 colleagues tested positive. To discuss these matters now, we're joined on the line by the Eastern Cape Health MEC, Cindy Swakomba. MEC, a very good morning to you. I want to start off with the story or the case around the nurses who refused, allegedly, to help a patient who may have presented with COVID-19 symptoms. Why would you suspend these nurses if they did not have the proper gear to handle the patient in question?
Thank you very much. Morning to you and the viewers. Let me put it in a perspective. Remember, I'm the last person to get to as an MEC in the department. I only get reports because administrative issues are carried out by the SG. Can I say in full Superintendent General this time so that I'm not mixed as to saying the SG?
Understood.
As it was. Yes, thank you. And Dr. Mbengache did give me a report to say on the basis that this is not the first occurrence in Grey Hospital where nurses have actually refused to touch less a COVID-positive person, and this time there's death. He is going to be giving me a report on the action that they would have followed. He did give me a report, but that report, as far as I know, was not already conclusive in terms of the number of suspensions, and the reason to suspend them is the fact that it is not in his view that it was only PPEs, because PPEs were available at the hospital. That's the report I got on the suspension of the nurses at Grey Hospital. As I say, I would be the last person, as they deal with the disciplinary actions, to actually come to me as to a final determination, whether a dismissal or reinstatement back to work.
All right.
Then that report will come to me.
Okay, so you've explained that particular case, MEC. Thank you for that. Now let's move to the Bisho Hospital, where a nurse has died and 3 of the colleagues have contracted the coronavirus. What is happening with that situation?
The sad news did come to me to say we've lost a highly placed, responsible nurse, a manager in the Bisho Hospital. And my condolences do go out to her family and friends and us as a department. And 3 more are positive. What normally would happen in a hospital is that there would be closure for decontamination. And that decontamination is why the hospital is closed so far, so that we are sure that the hospital is cleaned and that when others come back, at least the hospital has got some level of confidence. However, we also sympathize with our nurses. The fact that it is traumatic to work with somebody and get lost to COVID while in the line of duty.
MEC, the issue of PPEs is a long-standing one for nurses and healthcare professionals in your province. Can you tell us, without a shadow of doubt, that the protests that we've seen outside health facilities are now a thing of the past? In other words, are PPEs now readily available in all healthcare facilities in the province?
Well, the issue of saying, like in Grey Hospital, there were no PPEs, for me, after we're done a facility check where we assessed availability of PPEs, I thought it's resolved. Precisely on the basis, we took pictures, we went to stores where we found that there are PPEs. But I'm not sure what could be the issue with Grey, because somebody else, which is now under investigation, is saying even the relatives of the person, the demise, are saying after the demise, they saw nurses now in their PPE. So it's a confusing case until the investigation is over. However, on the other facilities that we have gone in, we saw that there's PPE, and those hospitals are relatively quiet after we went in and saw that there are PPEs. Remember, Frey Hospital was one of them. But when we got in and saw PPEs, it was quiet. It was no more an issue of PPE, but rather an issue of nursing COVID-positive patients.
MEC, just finally to you, and very briefly, if you can, there has been a lot of disquiet around your capacity to lead the health department in the Eastern Cape. Are you still the right person to lead that department?
As I answered you before as the NCA, I will still answer in the same positive way I said, that when you are deployed, you do the best that you can. I am not sure whether this is related to when I was deployed or now that you are talking about COVID-19. But in my view, we're still doing the best that we can as the Eastern Cape. We have not dropped the ball. We have even revised our own strategy, not necessarily that we do not know what we're doing. And remember, the department has got the top echelon of doctors who are then advising. And I do believe at the end of the day that as a politician, your responsibility is to guide the strategy, a vision of the department, which I still do.
All right.
So I would not be the best person to judge myself.
MEC Komba, thank you very much for your time.